Germany, and also as a guest, a supportive guest, Jordan Robinson, Vice President and Chief Operating Officer with the Mississippi Center of Advanced Medicine, will also be appearing in support of Dr. Gerhold. The reason for the appearance is that this physician does not meet the licensure requirements for a permanent license, and he has not completed the requirements as listed in the regulation that you can read there in the agenda. Dr. Gerhold, can you hear us?
Yes, I can.
Thank you for coming. Can you give us just a summary of about yourself, your training, and what you hope to get today?
First of all, I would like to thank the Mississippi State Board of Medical Licensure for giving me an opportunity to present to the executive committee. Can you all hear me?
Yeah.
Okay, perfect. Thank you so much. So the reason for requesting a meeting with the executive committee is that the reason for denial which was given to me was that you're an international medical school graduate who has not completed 3 years of ACGME approved postgraduate training in the United States or training in Canada approved by the RCPSC. The medical board has denied your permanent medical license request. So when I read the letter, I felt that it was representing the specialists of Canada only. In Canada, the family medicine is the professional body which is responsible for the training and certification of family physicians is the Canadian College of Family Physicians of Canada, whereas the RCPSC is the national examining and licensing body for the medical specialists. So in this case, if in case we look it up in here, then when I graduated from medical school, I was able to secure a residency in Canada. In Canada, we've got a 2-year family medicine residency training, which I completed. And after the completion of my training, I did write the certification exams. And after writing the Canadian certification exams, I was certified by the Canadian College of Family Physicians. And I do have my professional designation of CCFP. Now, the RCPSC could only be given to a specialist. So even if in case a family physician graduates in Canada, who is a Canadian, who has gone to a Canadian medical school, they would also only get the CCFP certification unless they have done a specialty training, let's say dermatology, obstetrics, and changed their career to family medicine or move from family medicine to the specialty field. So in terms of my training in Canada, it's a complete training. And after I completed the training, I have been in practice for 5 years. I've been practicing independently as a physician. I have my independent license. And at the same time, I'm actually an examiner for the Canadian College of Family Physicians. I've been an examiner for the last 3 examining cycles. And the only way I could be an examiner is if in case I have completed all my certification requirements. In addition, if in case we look into that, I've actually also done all the 3 USMLE exams. So at the time when I was applying for residency in Canada and the United States about a few years ago, at that time I had written my USMLEs also, USMLE Step 1, Step 2, Step 2 CS, and I became ECFMG certified. And my scores were high, they were above 250s. And eventually, I had matched into Canada because I had written the Canadian exams also, and I was automatically withdrawn from the US match. So I have completed them after I had written my Canadian examinations and I was certified in family medicine. I actually wrote my Step 3 also, so to complete all my USMLEs, because I think there was a rule of writing all the exams in 7 years. So if in case we look into that, I have written the licensing exams for Canada. I have written the USMLEs for the States. My training is complete in Canada. I'm working as an independent physician. So I think that when I was reading the statement, that's what I felt, that in terms of the training in Canada, it should have been that training approved by the RCPSC or CCFP. I did look at the other states license also, and one of them was Michigan. And I actually applied for the Michigan State Board license after I had received my denial letter. I got the license last week, and they do acknowledge the training from Canada, the USMLE exam. So that is what I feel, that if in that my training is complete, I've written many examinations, and so
Ma'am,
that's.
I'm sorry to interrupt you. I think we're slightly off our agenda, and that's okay. Uh, Are you Dr. Khalid or Dr. Gerhold?
I'm Dr. Khalid.
Okay. All right. We will. You've had a great presentation, so I don't want to interrupt that. We were just going to shift to agenda 2, or on item number 2 on our agenda. Good,
My
Dr.
apologies. I think.
Dr. Khalid, go ahead.
Okay. Thank you so much. So based on that, and I've been online too to look into the websites which I can present to you. The Canadian College of Family Physician is a website which provides all the information about it. The RCPSC is a website which provides all the information about it. I think one of the reasons why I am trying to, the reason for actually appealing and the reason why I do want to come to Mississippi is because my brother, he had gotten admission in William Carey College of Osteopathic Medicine, and he's a first-year medical student. And my sister, who has recently started her medical oncology, she has started working as a medical oncologist in Gulfport. And because my family has moved to, because my brother and sisters have moved to the state of Mississippi. And that is the reason where I feel that, I felt the need to be with them. As I think, as a family physician, I do value family. And I feel that if in case I'm contributing, to my country, Canada, then, I can be contributing to the state of Mississippi also. And I do see the potential in myself to be there for my community. In Canada, I'm also one of the physicians as an advisor for the Ontario Health Teams, which prior to COVID, they were in plan. So I think that that is my main reason, and I feel that I do have the credentials that are needed to practice as a physician in the state of Mississippi, and I think it's my family that is the major factor why I've taken that decision. And in Canada, I am working as an independent physician right now, so that was the main reason.
Thank you, Dr. Khalid. Can you tell us what specifically type of practice that you plan to practice? More hospital-based or outpatient? What is the type of practice that you hope to perform?
Yeah. So I would like to do outpatient family practice. It's something which where it's a practice where I would like to see my patients in my own family practice and provide a continuity of care, because that's where I see family medicine that's the main part of family medicine where I see it. So it's going to be outpatient.
Are there any other questions from the executive committee?
What I would like to add is that as a family physician, I think family physician is a field which I greatly value. And in Canada too, I have my own roster of patients. I do have my full practice. And the most important thing about family medicine is that we get to know our patients well through the continuity of care. And the physician-patient trust that is in a physician-patient relationship in family medicine, that is very important because we know our patients well. And I think if in case there would be teaching opportunities, which I get in the future, I would like to do that, because primary care is, it needs to be, the students need to be told about it as to how significant it is. And that's what I see it here in Canada too, and I would like to do that in the States too. Because when I was giving my family medicine interviews in the States about 7-8 years ago, that is what was important for me at that time, and I did practice it for the last 5 years, and I would like to continue that. I think I would be a good asset for the state of Mississippi.
Dr. Owens?
Dr. Cullen, what is your practice like now? What kind of work are you doing? Is it a traditional family medicine practice where you also see some pediatrics, or is it, do you have a particular area of focus?
So the family practice, which I do, focuses on patients of all age groups. It is from the time, our patients, they're pregnant till the end of life. So I do provide prenatal care. And in Canada, we usually provide prenatal care up to 20 weeks of gestational age. And after that, the care is transferred to the OBGYN. So I provide care to my patients until 20 weeks. If in case there are medical complications, I do stay on board with the patient and we provide joint care. But the OB comes on board after 20 weeks. In regards to the kids, the adults, the geriatrics, we do the annual physical examinations, provide well baby care, well baby visits, immunizations, updates, PAP tests, along with if in case a patient is in our roster, they usually become our patients, so we follow them. So if a patient calls the office, they will say, Dr. Khalid is my family physician, so I'm basically treating them for all the medical conditions also, which are in my scope of practice. And once I feel something is not in my scope of practice, I refer them to the specialists. In regards to palliative care, definitely, we do help in making the diagnosis. Let's say if a patient comes with rectal bleeding, then, definitely we have to bring the patient in for the examination. After the examination, go through the investigations, and then we refer them to gastroenterology for the further management, such as a colonoscopy if needed, based on discussion with the patient and informed consent based on their age. So I would say basically I'm following the patients all throughout. And once the patient is referred to a specialist, the specialist writes the note back to me stating that Dr. Khalid saw your patient diagnosis having colon polyps, repeat colonoscopy in 5 years, so I follow the patient. And if there's anything changing, then you refer the patient back. But they're basically patients in my roster.
Dr. Miles?
Dr. Miles, your residency in Canada was a 2-year residency in family medicine?
Yes, in Canada, the family medicine training is 2-year long, and after 2 years, I would say the College of Family Physicians, they recognize that, and then you have to write the certification exam. If we pass the certification exam for the Canadian College of Family Physicians, that is when we are able to practice family medicine independently. So the training is complete from that aspect.
Thank you, Dr. Williams. I think one of our colleagues was a nurse at 3 years. And in Canada, it was only.
Yeah, in the United States, it's a 3-year training because in Canada we have a lot of physicians who have come from the United States to Canada, so they are easily able to merge into the system because their training is 3 years, and it is a 2-year training in Canada, so they're able to do that. In the United States, I'll give you an example. Internal medicine is 3 years because my sister, she did it from Fairview Hospital in Cleveland. So when the U.S. internal medicine graduate returns to Canada, Canada's internal medicine is 4 years. So that is where they have that, where there is a change. So I think they have their own rules for internists. So many physicians, they do a fellowship in geriatrics or so to complete the 4-year or 5-year training. So it's that's the main thing, which is different in both countries, and I've seen that.
I think that was one of the questions. You had 2. Our regulations say 3, but if 2 is what you're supposed to have in Canada, and you pass the examination. I don't see a problem.
I'm sorry, sir. I'm not able to hear. Hello? My apologies, doctor. I'm not.
Dr. Miles, yes, if you could repeat your comment.
Oh, well, wearing these, it's hard to get through the COVID block. I think one of our problems was our regulations say 3 years of ACGME approved postgraduate training, and you have 2, But if that's what Canada, that's all Canada requires, then, and you pass the exam, then I think that clears it up for it.
Yeah. And I've passed the Canadian licensing exams also, done the Canadian certification exam also. All the USMLEs have passed. First two USMLEs were above 250s. Third USMLE was also passed. All of them were passed on the first attempt. And I'm an examiner for the College of Family Physicians. And I was able to get the Michigan State Board license last week, which I would like to update my file. I'll email the Michigan State Board updating them.
Thank you. I have no other questions.
Thank you. What's the sense of, would the executive committee be willing to go ahead and vote on this item, or do we need to go into executive session?
I'd like to just move that. I don't think that we need to go into executive session, according to me. It seems like it's kind of more an administrative thing. And even with the 2 versus 3 year requirement, it's also an individual who's
I'll make
additional.
a motion with accept the application.
Second. Motion to grant
Right,
the
grant the
waiver,
waiver.
made by Dr. Miles, seconded by Dr. Owen.
All in favor?
Aye.
Dr. Khalid, congratulations. Executive committee has approved your request before our executive committee.
Thank you so much.
You will not need all of those coats that you use in Winterpeg. I will tell you that for sure. Very different climate down here.
Yes, and my brother and sister, they're down there, and I was in Mississippi last year during the winter time, and I liked the weather. But my sister, she's liking it there. My brother, he's liking it. So I would say that I would be happy to be a part of the state of Mississippi, and I would say progressing more in family medicine is something which I'm very passionate about, and it's something.
We're happy to have you.
Thank you, Dr. Khalid.
Thank you so much. Thank you.
So we will now move on to agenda item 1. I just wanted to be clear about the name of the applicant. Next on the item is personal appearance of Dr. Kirsten Gerhold.
Yes,
Gerhold, can you identify yourself, please?
yes, it's me. It's Kerstin Gerhold. Thank you.
Thank you. So you are an applicant for an international, you're an international medical graduate, pediatric rheumatologist, pediatric residency with training in Berlin, Germany. And also you do not meet the licensure requirements for a permanent license, and that you've not completed the requirements as listed in the currently stated regulation. Can you also give us a summary of your training, your desires to practice medicine in Mississippi?
Yes, thank you. Thank you for the opportunity of this appearance, first of all. I have accepted a position as a pediatric rheumatologist at the Mississippi Center for Advanced Medicine, and I'm applying for Mississippi license. Currently, I hold a conditional subspecialty license in Canada, granted by the College of Physicians and Surgeons of Manitoba in 2014. I have been practicing medicine as a pediatric rheumatologist and section head at the University of Manitoba in Winnipeg. This is actually Winterpeg since 2014. I'm currently an associate professor of pediatrics at the Radi Faculty Health Sciences, Max Radi College of Medicine, University of Manitoba. My medical training, including my training in pediatrics and pediatric rheumatology, took place at the Charité in Berlin. The Charité Medical School has been recognized as a top 10 medical school in Europe, and the Charité Hospital has been recently ranked the 5th best hospital in the world. I graduated from medical school in 1998, and I finalized my thesis and achieved a doctorate in medicine with magna cum laude in 2000. My specialty training in pediatrics occurred between 1998 and 2006. During my time as a pediatrician in training, I took an additional 24 months to work as a basic medical science postdoc in the pediatric immunology research lab at the Charité. I passed the pediatrics board examination in January 2007. I completed my training in pediatric rheumatology from 2007 to 2010 and passed the pediatric rheumatology board examination in 2010. I was awarded with a degree of habilitation in 2009, and this is a degree in Germany that allowed me to be a faculty of the Charité, and it's also a prerequisite of a professorship in Germany. I also took additional time during my pediatric rheumatology training to work towards a master's degree in epidemiology, which I completed in 2012. Between 2010 and 2014, I worked as a pediatric rheumatologist in a tenure position at the Charité prior to accepting a position at the University of Manitoba. Between 2012 and 2014, I held a leadership research position at the German Center for Research of Rheumatic Diseases. And between 2012 and 2014, I was a member of the doctoral thesis committee at the Charité and a member of the examination board for the specialty certification in pediatrics in Berlin. I continue to have an active research career with which has led to over 40 reviewed publications by now. Since accepting a position with the Mississippi Center for Advanced Medicine, I have passed the U.S. medical licensing examination and have completed the ECFMG certification process. My specialty training in pediatrics and pediatric rheumatology at the Charité Hospital in Berlin is quite comparable to pediatric residency and fellowship training in the United States, and I have outlined that in the tables you hopefully have gotten. Additionally, I have extensive experience in clinic practice and as a leader in pediatric rheumatology. I look forward really to working with you together. The reason why Mississippi is actually my husband is from the South. His father was from Georgia, his mom from Tennessee. He grew up in Florida, and he was actually at Hattiesburg at the universities there for part of his university education. We feel that people from the South have a lot of heart, actually, and they're very open, and they just, I think we just feel it fits what we try, how we try to live our lives. And this is why we think together that Mississippi will be a good match for us. From a professional perspective, when I learned about MCOM, I identified with their vision and approach of care. The idea of coordinated and interdisciplinary care and open communication is my heart of practice, and it's not naturally occurring in particularly in bigger facilities. So this is how I try to practice and how I want to practice, and this is why I chose MCOM. I also want to practice where I can make a little bit of difference. I believe that a third or fourth pediatric rheumatologist in the state will improve access to care for patients in the big state where the population is probably spread out as well. And it will, give more patients access to care for rheumatic diseases, which are often disabling diseases. With my skills and expertise, I will also bring in a new perspective on management actually of pain, particularly chronic pain in children and youth into Mississippi.
Thank you for that, Dr. Gerhold. Are there any questions from members? Thank you. Dr. Gerhold, your speech very impressive. I'm certainly personally very happy that someone of your experience and training that you're coming to Mississippi. I did med peds, and so I have exposure to the pediatric rheumatology world. and we have a dire need for more pediatric rheumatologists in the state.
Thank you.
Dr. Miles, I'm very happy that you like the way the people of Mississippi are in the South, open. We found them to be that way, and although we're trying to keep it quiet, we enjoy living here, and I think you will too.
And members of the board, can I just offer a few thoughts from Mississippi Center for Advanced Medicine and our perspective?
Yes, go ahead.
So I'm Jordan Robinson. I'm our Chief Operating Officer. I'm here at MCAM, and Dr. Gearhold is being very humble, as she always is, but we just wanted to reiterate that in our opinion, she's one of the most well-qualified pediatric rheumatologists in the world, and also within the field of pediatric pain. As she mentioned, Charité, where she trained, is the #1 medical school in Germany. And then she went on and did her training there. It's considered a top 5 hospital in the world, behind only the Mayo Clinic, Cleveland Clinic, and Massachusetts General Hospital in the United States. She's, of course, the sitting division chief for pediatric rheumatology up in Manitoba. She founded the pediatric pain program up there. Her bedside manner, her demeanor, and her passion for serving children is all of the things that really attracted us here at MCAM to hiring Dr. Gearhold. She, in addition, has numerous research publications. In the United States, there's only currently about 350 pediatric rheumatologists in active practice. 1 in 20 children suffer from chronic pain in the US, about 300,000 kids with arthritis, 30,000 with systemic lupus, and 3,000 with dermatomyositis. Her very unique skill set, I think, will not only help patients within the pediatric rheumatology community, but also really make a lasting difference on the impact of the children in the state and the opioid epidemic in our state, and managing those kids in a new and unique way and helping prevent them from starting on opioids. So with that, I just wanted to, again, offer our full-hearted endorsement of Dr. Gearhold. We would be honored to have her practice medicine at Mississippi Center for Advanced Medicine and in the state of Mississippi.
Thank you for those comments. Any other discussion from the executive committee?
So there is not a question, but just a comment. She's a unicorn. There are not a ton of pediatric rheumatologists, especially someone with as extensive a CV as she has, and not just for Mississippi, but the other part is, if you think about what's in Louisiana, what's in Alabama, like even our neighboring states, there just aren't a lot of pediatric rheumatologists floating around, and especially not in the Southeast in general. So I think there's not a question as to the need. I think all of the pediatric rheumatologists that are in the state of Mississippi are all at the medical center. And there are, I think, to date, 3 of them in total. So I think this would be an excellent addition, and I would strongly support approving this waiver.
Dr. Gearhold, I want you to understand that we have not questioned your training or your ability or anything. Just once in a while, we have to write rules, and somebody gets caught up in the little fine points, and you're one of them. But I think it's obvious here that you're well trained, and this wasn't meant to catch you. We're sorry that it has been some sort of problem for you. This is maybe an indication we need to look at our rules again, because I think you're eminently qualified to practice in the state of Mississippi, and I think you're of immediate need.
Thank you.
I'd like to entertain a motion for acceptance of her
Or granting of the waiver?
granting of the waiver and her application for a full unrestricted license in Mississippi.
So move Owens.
Second.
Miles.
All in favor?
Aye.
Aye.
Oh, sorry.
Dr. Gerhold, the executive committee has accepted your application for a license in Mississippi.
Thank
Congratulations.
you. Thank you so much. I really appreciate it. Wow.
Thank
Is there any other business of the executive committee? Motion for adjournment.
So moved.
Second.
Your form, sir?